We'll see if it'll load. All right, so chapter 16 is going to be all about falls. This is one of the most important subjects that you're going to talk to older adults about. You're going to talk to them in every single setting about falls because it is much cheaper and it just makes sense to try to prevent a fall rather than it does to treat the injuries from a fall, right? So a fall, we're going to define it first, is an event that results in a person coming to rest inadvertently on the ground. Pretty much self-explanatory, right? Or to another lower level. So they don't consider just a fall falling to the ground, but they can also fall into the bed, fall into the chair, and it can have with or without an injury. Falls are extremely important in facilities. It does not matter if the patient got hurt or not. Every time a fall happens, it has to be reported, okay? That is a major, major safety concern. If somebody falls in a facility and you don't report it and they find out later that you didn't, that would be grounds for termination like that. It's very important, okay? In a given year, about 1 in 3 of older adults will fall, and it gets way worse the older people get for all the different reasons that we've talked about. Jamming. All right. Falls have a high personal and societal cost in terms of function, quality of life, and cost of care. Again, falls are very expensive, especially if injury happens, and it's way cheaper for us to treat them before they happen. All right, so where do falls occur, and when do they occur? Most of the falls happen in people's houses, especially in the bedroom, but really in the bathroom. Where do you think is the biggest risk factor for falls in a house? Huh? No, the bathroom is the most common place that people fall. The shower. Getting in and out of a shower is the #1 place that people fall. So what piece of equipment do you guys all know prevents that? You said a grab bar. What else? What's over there in the tub? Yes. What's a grippy thing? Like the mats? Okay. What I was getting at was the tub transfer bench, because people mostly fall in the shower when they're trying to get in and get out of the tub. That's when people normally do fall. So if you take that aspect out of it, you've dramatically decreased the risk of falls. So if somebody has poor balance and they're able to have one of those are kind of bulky and they don't fit in a lot of people's bathrooms, unfortunately. Then your next best thing is to move into the grab bars and stuff, other things that you can do. That's the best because they don't have to step at all. They sit down, pick their legs up over, slide across, right? Makes much more sense. Falls are more common in the winter. We actually call winter in therapy world hip season because you'll all of a sudden not have hardly any broken hips, and then you'll have this huge influx of people with broken hips because they went out on the ice on their sidewalks and they fell. Falls are more common among people living in long-term care facilities or during hospitalizations. This is why you see these signs in people's hospital rooms that says, "Don't get up," and it's in red. Use your call bell, stuff like that. A lot of people get confused in the hospital and in long-term care. They think they're at home or whatever, and they're looking for someone familiar. They get up out of bed. They don't mean anything by it, but they fall. You'll see a lot of times patients will have, if they have a history of falls, they will put like cushion pads on the sides of the bed in case they roll out of bed or they stand up and fall to try to help, the risk. Because unfortunately, you're not allowed to, in a lot of facilities, put the arm or the bed rails up. It's considered a restraint, and that's not allowed in a lot of long-term care facilities. So they have to keep those down. The best case scenario is, if they do get up, you still know they're going to fall. It's kind of a catch-22, but you can put that mat there and hopefully they won't get injured. and hopefully nursing staff will catch them, trying to get out of bed before they fall. So 1 out of every 4 falls results in an injury, and many people never recover from a fall. A lot of people don't. A lot of times falls are what take people out of this world. They're very sad. Again, I told you guys that's kind of what happened to my grandpa. Is he was doing fine, woke up in the middle of the night, he tripped over a dining room chair, he fell, he broke his hip, and he never recovered from that. He was gone within, I think it was 6 months after that. It's a huge deal when people fall. The most common injuries are bruises, contusions, or lacerations, sprains, fractures of the pelvis, hip, upper extremity, distal radius, spine, skull, and ankle. So literally everything. It depends on how they fell and where they fell. And some injuries, unfortunately, result in death. I've worked with several patients who fell in their bedrooms and they get pinned in between bedroom furniture and they just can't get up. They can't roll one way or the other. There's no room for them to maneuver. So it's really important that they don't hurt themselves getting up. Let me put it this way. If there is no injury, I'm going to teach you a way how to teach them to get up. Okay. But a lot of the times it's better for them to wait and get help when someone's, available. Now, if somebody lives alone, they have no friends that come check on them, stuff like that, totally different story. You don't want those, people to, regardless, they can't lay there and die. They have to get help. But I always recommend a life alert or something like a life alert. I think that every old person should have an Alexa device in their house, because even if you're in the other room, you can scream, "Hey, Alexa, call 911." It's a massive safety help. But again, you have to have older people have Wi-Fi and stuff, that right things have to work. But something that they can call 911 without having to get up is always the best. Okay. All right, so what are some risk factors of falls? There's some intrinsic factors. Again, that's anything internal, their age, all that stuff. Extrinsic factors, it could be things like the environment. It could be medication. A lot of medication can make people's balance feel off or make them feel confused or whatever. So it's important to know side effects of medications too. But both include risk factors that can potentially affect how you're going to treat the patient and what their risk factor is. Some modifiable things. What is the number one? So I told you the number one place for falls was getting in and out of the bathtub, right? What do you think is the number one thing that causes falls? Huh? Rugs. Throw rugs are the freaking devil. And when I was a student, I just never imagined that it would be difficult to tell people to pick up their rugs. Holy crap. You think that you've insulted an old lady like to her deepest level when you say you need to pick up that rug. But it is so important that they don't have throw rugs around. If they insist on keeping their throw rugs, what can you guys do to make sure that they're happy and as safe as possible? Huh? Carpet tape is a big one. What else? Start playing Jeopardy music. Maggie, how could you modify a rug? That's carpet tape. Okay, if they're willing to move it. What about lighting? Making sure that it's well lit in the area that there are rugs. What about they have little rubber grips that you can put on it that aren't necessarily carpet tape, but they're like, they almost look like furniture movers, but they're rubber on the bottom, so it helps keep it in place. What about swapping the rug for one that does have a rubber bottom on it? And there's a lot of different things. Unfortunately, especially in Appalachia, you see those old like multicolor rugs that I feel like everybody's grandma has. You know what I'm talking about? Like the handmade. You did have one? I know I have one. Okay. Well, see, those are a massive fall hazard. You should pick them up or put rubber on the bottom of them. All right, so some non-modifiable things are vision deficits. If the person just simply, if they have glaucoma or whatever, those are things that you really can't do anything about. But the thing about it is with risk factors and interventions is you need to make them very personal. Don't go in saying, oh, you got to do this, oh, you got to do that, and pointing fingers. Give them that options that we've talked about on, hey, what do you think is the benefit of keeping that rug there? Here's some things that, show that that's a huge fall risk. I'm just worried about your safety. What do you think we can come up with to make this work? That kind of thing. Don't go, oh, you got to pick up your rug. Another one is small animals. Do you remember the modification I told you with small animals, what you can do? The bell on their collar, just to let them know that they're there. Unfortunately, Fluffy just wants to be petted and is wrapping around, Grandpa's feet and going to make him fall. Can't do that. All right. So one huge issue you guys are going to face, especially if somebody has already fallen, but it can happen with people that haven't fallen yet, is the fear of falling. So many people are scared of that. That makes them extremely hesitant to do anything with you in therapy. If you can't get them out of bed or out of their chair and that's where they want to stay because they feel safe, you're literally taking them out of their safety zone. They do not like that. You're making them do something that scares them. That's definitely top 5 of the most common things you're going to see in working with elderly people is the fear of falling. They're terrified of it because what I just told you, it can result in, we fall down. Yeah, we might get bruised up a little bit. You're talking about potential death from a fall, just a normal fall from an older adult. Totally different world from what we're used to. It's a lot of anxiety. I mean, you'll literally see these little old ladies and little old guys in an anxiety like panic attack because you're trying to stand them up. Even if you have like you and a physical therapist or whoever standing them with a walker and the bed and the wheelchairs behind them, you would think that you're, making them face their worst fear ever. It's because you are making them face one of their worst fears ever. So, you have to be very, you have to be very personal with that person. You can't let them feel like you're going to drop them, but you have to convince them, that they're safe. One area that a lot of, female OTA struggle with is getting like an older adult who has fear of failing or an older man that might be bigger size and the female coat is a little bit smaller. Oh, you'll never pick me up. Oh, you may have everything in place. The bed behind them, you may have help, walker, all this stuff, everything to prevent them from getting hurt. Even if they did fall, they would go plop down on the bed, anything that you had that would be safe. But you're going to have these people that's just going to be like, you are never going to lift me, or you're never going to be able to help me. If I go to fall, you'll never catch me. How do you address that with a patient? Jennifer, how do you address it? You have this big guy, he fell, he broke his hip. You go in and say, okay, we're going to stand up today. And he has this huge fear that you're going to drop him and that he's going to fall. How do you address that? Okay. What would you do? Bring somebody else in. That's always a big help. It depends on what your session is. A lot of times their fear of falling when you're addressing it is getting them out of bed to the wheelchair to take them to a therapy gym. That's a big time. Well, that, or if you're having them do a dynamic standing task or something, then you may have somebody beside of them. One thing that I always like to do, and I've seen other people do, was walk them through it and be like, okay, so I get it. You're scared of falling. Let's sit up on the side of the bed. Take it in steps. Okay. Then stand and say, and before you stand and say, even if you did go to fall, where are you going to go? And so you're going to go right here on the bed, right? I need to back up and make sure that we're clear on something. When I said earlier that a fall can mean a fall to the bed, it's if they tried to get up and then they fell and just happened to fall on the bed. If you're there with them and they just, sit down or plop down on the bed, that's not a fall. That's not what I meant. If they get up and tried to, and they were getting ready to take off walking and they fell back on the bed, that's a fall. Does that make sense? Okay. So anyway, taking it step by step, little by little before you transfer them or get them to standing is a good helpful tip, or getting somebody else there to help you. Okay, just to make them feel more safe. Eventually, they'll learn that you kind of know what you're doing. You've been trained to do it, so you're good to go. All right. Fall risk and fall prevention assessments. A lot of times we do screenings. We'll look at people who have previous falls, if they have poor physical activity, difficulty walking, or difficulty doing daily tasks. A lot of times they'll send OTAs to do the screenings. Say, hey, go check in the long-term care. Go walk down and see if you see anything different. If you have a low caseload that day, you might notice that Ethel in 3B has, she was walking or furniture walking in her room, trying to grab a hold of everything. Maybe we could pick her up and work on some functional mobility, that kind of thing. Assessment should include your subjective, medical, and fall history medications, and your objective, which is their mental status, strength, and balance measures. So that's all kind of stuff that you put in your screenings, and we'll go over those a little bit later. So the process of identifying falls and fall prevention. So first is identification. So saying, hey, this person is, at a fall risk, or might be at a fall risk, this person. Assessment, that's really just kind of testing to see if they really are a fall risk. Management, that might be if you put a fall prevention program in. I was the fall prevention program manager at Genesis. They would have me come in and work with a lot of long-term care patients or short-term patients and teach them about falls and preventing them at home. Implementation, that is doing the class or doing the intervention or whichever, and then monitor and review, that's just watching the patient as you let them go. So maybe they've been discharged, they're getting towards the end of their run with therapy, just watching them and then constantly reviewing it, constantly checking in and seeing how they're doing. Okay. All right, so intervention, fall prevention education has been found to be very effective. Again, that's just kind of what I was talking about, doing a class with people, educating them, getting before a fall, educating them on those risk factors. Okay. But a multifactorial interventions are always the most successful, whether it be just an education or whatever it may be. Okay. You could do some exercise with these patients. Resistance and balance activities helps a lot with fall prevention. Functional interventions like assisted devices. You may give this person a walker so they don't have to bend over so far. That decreases their fall risk. You may have them perform their ADLs with you and see if there's something that you can do, a comp strategy or energy conservation technique that you can teach them. And then gait and balance, looking at all of that stuff too, to see if there's something that you can come up with. Fall prevention is something that's really all encompassing. I think it's very true to OT because it's all about safety. So some fear of falling interventions, I've already kind of touched on these when I told you some of those helpful tips about fear of falling. But if you can help increase their balance or show them that their balance is actually not that bad, which is another common problem, probably the safest place that you can take them is, say, if you're in a therapy gym, is take them over to what's called the parallel bars. Have you ever heard of those or seen that? I know you have. Does you guys know what I'm talking about when I say parallel bars? So take them over to that in their wheelchair, locking their brakes, moving their little feet holders out of the way, and have them stand up at the parallel bars. They aren't going anywhere. There's literally nowhere for them to go. They can either go forward into the parallel bar, but that's just going to stop them, or they can go backwards and sit in their wheelchair. There's nowhere. They can't go side to side. So showing them that their balance is really not that bad at somewhere it's a super safe environment is also really helpful. Improve their muscle strength, eliminate environmental hazards, education and counseling, and behavioral modification. Some other things are community risks. A lot of people don't think about this, but if you go in, let's say, an adult living facility, and you notice on your way in that the sidewalk is uneven or has a lot of cracks in it, or even the parking lot has a lot of potholes or stuff in it, that is a huge fall risk. We've already done, no, we haven't already. Did you guys go out to like a local place here yet and assess their the handicap accessibility. I'll plan that one day soon. I'll have you guys go to like Hobby Lobby or somewhere and go look at the parking lot, go look at their sidewalks, look in the store and see if it's truly handicap accessible. Would you deem it handicap accessible? Are they barely meeting the standards? Are they exceeding? Are they falling short? All that. We'll do that one day to kind of break up the lecture monotony of things. Okay. And then reduce other factors like nocturnia, the poor sleep, reduce or address postural hypotension. A lot of people have, you know, that when you stand up and your blood pressure drops, the hypotension or postural hypotension, that's a cause of a lot of people's falls. Just saying, hey, don't jump out of bed in the morning is helping to prevent falls. Take it slow, and then medication management too. All right, I do have a couple videos. Technically, class is over, so I'm not going to make you stay, but I'm going to play them anyway.